This is KTVO's Good Morning Heartland.
And welcome back. When visiting a doctor's office, you have doctors, nurses, nurse practitioners, and physician assistants. But do you know the difference? We have Callison here this morning to break it down for us. How are you doing?
I'm doing well. How are you?
Good. So you're a physician assistant. So exactly what is a physician assistant?
That's a good question. A physician assistant is a medical provider who is licensed to practice medicine under the supervision of a doctor. And the word supervision is, it kind of throws things off a little bit. Very rarely is a doctor actually directly supervising a PA in the exam room. More what supervision means is a overseeing doctor is regularly reviewing PA charts and is available for consult if needed for that PA.
So what are your duties then? When we, I know that I actually saw you a couple months ago. I thought I had the flu, and I came to get a test for the flu, and you were there, and I didn't really see a doctor, but I saw you and a nurse. So what are your duties?
So the duties of a PA are very similar to those of a physician or of a nurse practitioner. As a PA, we can diagnose and treat common illnesses. We can prescribe medication in all 50 states. We can also order and interpret laboratory testing and other diagnostic testing if necessary. And of course, we're there for educating patients also. And this does vary depending on whether the PA is working in a hospital setting versus a clinic setting, and also if they are specialized.
Okay, and you roughly just said something about nurse practitioners. So what's the difference between the two?
That's a really good question, and actually I get that question a lot in practice. So PAs and NPs are very similar in many ways, and we're actually both classified in a kind of a larger category called mid-level providers. And what that means is kind of in the hierarchy of healthcare providers, we fall somewhere between an RN and a physician. And both PAs and NPs can, again, we can diagnose and treat, we can prescribe medications, order and interpret different laboratory testing, educate. Really the big difference comes in our training. Nurse practitioners start off with their 4-year bachelor's in nursing, and then will go on to complete their advanced nurse training. During this time, they choose a specialty. This may be pediatrics, adult primary care, this may be surgery. Whatever they choose to specialize in, that's what they're trained in, and when they're out in the field working, that's what they work in. It's a little bit different for PAs. We start off with the 4-year undergraduate degree. Okay. Usually this is within a science like a biology or exercise science or chemistry. And then we go on to do a PA training. This is usually within a larger medical school. And we're kind of trained in a variety of different medical specialties, but usually with a focus on primary care. And so when we're out in training, we actually have the choice to work either in primary care, or we can specialize, and if we choose to flip-flop or change things around, we have the ability to do so. Another big difference between a PA and an NP, depending on state regulations, some nurse practitioners can actually practice independent of a physician, whereas in all 50 states, PAs are required to practice under the supervision of a doctor.
Okay. Now, if you ever wanted to change and go back to school, is it easier for you to become a doctor than if it is for somebody that is starting from scratch?
I don't actually know of any bridge programs where you can bridge from a PA to a doctor. There may be some out there. I don't think it's very common. Okay. As far as my knowledge, you have to actually go back and do medical school over from scratch.
So if somebody comes into the doctor's office and you're there treating them, not to be alarmed, you know what you're doing, and there's always the doctor there to consult if you have any questions, or if they have any other questions like that too as well, right?
Absolutely, and the doctor may not necessarily be on site, but they're always available by phone if we have any questions or any concerns.
It's always good to know, you know, we always see all these different faces at the doctor's office with all their titles, but it's nice to know what they actually are. So thank you so much for clarifying that. And what we'll do is we'll post all of this on our website at heartlandconnection.com, as well as Complete Family Medicines, which I forgot to mention, that's where you actually practice, is at Complete Family Medicine. So, all right, thanks so much for your time.
Thank you.
And we'll be right back.